Okay. Well, good morning, still morning. Good morning, everybody, and thank you for joining us for our December Behavioral Health Forum. We have a couple of topics today. One, we're very excited to announce the launch of the Capacity Connect dashboard. And then if we have time after that, we'll talk a little bit about the 2021 behavioral health workforce investments that the BHT board has approved since we last met, and talk about some ideas around that. But we really want to give the majority of the time to getting to know the new Capacity Connect dashboard. We've talked with this group before, and I want to give a special thanks to a few of you here in a moment. The Capacity Connect dashboard is something that we've heard from you guys, our providers, would be so helpful. We've heard it time and time again, and COVID kind of finally gave us an opportunity to get this on board. And what it is intended to do is be a place where we can look at what is the capacity of our behavioral health system at a point in time. As we go through this, we have Jessica Ford from Zipline. They are a local company that we worked with to do all the tech things that BHT is not capable of doing internally. And so we're very grateful to have worked with them. But I want you guys to think as providers as we go through this. This is one of those tools that is only as good as you guys make it, only as good as the number of partners and providers who are willing to participate in putting their information in. One of our goals as we worked with Zipline on this was to make sure it is really quick and easy to keep updated for you guys. So there's a little bit of setup on the front end, and from there it's intended to take no more than a minute or two to keep updated. We know that you guys have about 6 million things you already do in a day, so we don't want this to add to the burden. But at the same time, to be a useful tool, it has to be something that we all use. So with that said, I am going to hand it over to Jessica to share with us what that looks like. And you guys are welcome to put any questions in the chat or shout them out as we go along. And we'll also have some time at the end for that.
Awesome, thank you. So I'm going to start with just a little bit of an overview of what the dashboard is. I know many of you have seen it, but I'm sure there are a few people that haven't. So I'm going to share my screen real quick and just run through that. Oh, so I did have the button at the bottom, but it says host disabled participant screen sharing.
Okay, see if you're able to do that now.
Sorry about that.
No problem.
Okay. Awesome. So you now should be seeing the home page for the Capacity Connect dashboard. So this piece is accessible to everybody. It's just a basic search. You could search by category or by zip code. And once you do that, you're going to be taken to a search results page. Right now, and this is where you guys come in a little bit, we don't have very many facilities entered into the system. So right now it's coming up with nothing, but we did enter some test facilities so that we can see what they look like and we could do our testing on our end. And this is generally what each listing is going to look like. These are our categories for capacity. So the main goal, obviously, is to show how many open spaces you have in each category and whether you offer that service. So the idea is that someone can quickly see, whether there are spaces open in the category they're looking for, and then get a little bit more info if they think it's a good fit, and then easily reach out to whoever the designated contact person is. And maybe that's not a person, maybe it's a website, maybe it's an info at, email, or admissions at. So there are some options there, but that's generally how it's going to look and function. We've got some filters by service on the left and by population, and some sorting options here. And so one of the biggest things we need your help on is creating these listings for your facilities. Another thing I'd like to do is use you guys a little bit as testers. So with me entering fake information, I'm less likely to hit a snag than with you guys going in and entering your actual information. So you might have some really great feedback for me. So I'd like to gather that as well. Let's see. So what we're essentially going to have you do, if you're available for it and would like to add your listing, is I will create a login for you, and I'll talk about how to get that info from me at the end here. Okay, so I must have changed my password and forgot about it. So I'm going to reset that real quick so I can have the right view.
While Jessica's setting that up, you may have seen a couple of familiar names in that list. So I think it's probably a good time to thank them. Ron Tussey and Sarah Spear and Kelly Miller all helped with the testing of this. I want to thank everyone too that participated in the focus groups and all the feedback that you guys gave here in this group around that. It was incredibly helpful. So that's why you're seeing those names pop up. They took some extra time with us to do some testing and help with the development. So thank you guys so much.
Yeah, definitely thank you to you guys. It's great to get that kind of insider knowledge. You know, I can guess what you guys do, but you guys really know exactly what needs to happen here. So when you log in, you're going to see this sort of blank screen because you don't have any facilities added yet. And you would just select create new facility. When I have you reach out and I start setting up your login information, I'm going to need the organization name. So when you log in here, you should see that and you would select your organization. For me, I just did a test one. And then you're basically going to walk through each of these fields and fill everything in. I'll touch on a few things, but most of it should be pretty self-explanatory. And one big thing to note on this is when you first set it up, you'll need to fill in all of these fields. But really over time, what you'll most be updating is just the current capacity. Everything else should be pretty consistent unless you have like a phone number change or something like that. So organization, you'll select from the dropdown. You'll enter the specific facility name. So if you have multiple facilities, you're going to have one listing for each one. Hours of operations, this is pretty open. So you could even enter something like, 8 a.m. to noon on weekends or Sundays by appointment. We didn't want to limit that too much because we know that can vary quite a bit. Some basic questions here that searchers might need to know. Your population served. Again, an open note field for insurance is accepted, so you can, enter that however makes sense for you guys. Over here in the capacity section on the right, you're going to enter a number for how many open spaces you have for that program. If that's something you never offer, then you would select not applicable. And that's just going to kind of gray it out. So it's clear that it's not that you're empty, it's that it's not a service that is available. Again, you're going to select your services down here. I imagine these won't change too often. We've got exclusion criteria, MAT accepted, and anything that is not required, if you leave it blank, simply isn't going to show up on the front end. So if there's something that doesn't apply, you would leave it blank. This contact information section is for whoever you would actually want someone to reach out to. So it's not necessarily you, but it might be. It also might be that you put, customer support for first and last name to kind of keep it simple if you don't have a specific person. One thing that is worth noting right now is that when you enter in the website, you want to have the full website, including the HTTPS at the beginning. So I like to just pull it up, copy the whole thing, and drop it in there. Oh, missed that name. So as you just saw, it will let you know if you make a mistake or miss a required field. But once you get over the item I missed, then you're going to see your facilities here. And so from now on, now that you have this set up, when you log in, this is what you'll see. It's going to show you what your current capacity is listed as. And then if you need to make a change, you would just go edit, and it's going to take you back to that same screen where you can edit your numbers. So what I'd like to do is, for anyone that is wanting to set up their listing, if you can just reach out to me, I can set up your account for you, and then you would be able to log in. I'll give you the URL and everything. And then as you go through and enter this and set up your facility listing, if you hit any issues at all, if you get a weird error message, you're kind of also our testers now, since this is not live quite yet. So I would then still be the contact person for you to, just send me a screen grab, maybe a note, like, hey, I noticed this. That would be a huge help, because then we can just make sure we get everything fixed up before we launch. One thing to note too is if you log in now, you've got your credentials, you create your listing. When we do launch, that work won't be lost. It means that you'll be one of the first people to be listed on there when it's live, until more people can add their listings. So you won't have to redo it again. You won't have to reset your password, that kind of thing. So basically, I just typed this up real quick. I can also shoot an email. I think I should be able to access everyone based on the meeting request. But if you do want to add your listing, just shoot me an email at jess.ford@ziplineinteractive.com. These are the items I'll need. Just your first name, last name, the email address you want the account tied to. If it's the same one you're sending from, then no worries. I'll just make that assumption. And then the name of your organization, as you would want it displayed publicly. So that's about all I've got. I think I've got at least about 20 minutes. If anyone has any questions, we might have a little bit more time.
Great. Thank you. So I do have a couple of questions in the chat. One is whether MAT or employment services are an option within settings. So I know we had a space for where MAT is an option. Can you go back to that page?
Yeah. So you should be seeing it now. So we've got an open field for MAT.
And do remind me, do we have a place for additional services? It looks like they're the brief description of services offered or unique or special services. So that was where someone could put in something like employment services and things like that. We didn't include it as a specific field here. We kind of tried to meet in the middle and think about where are the services most often offered by our folks in our behavioral health. So, and then towards the question from Joy about how outpatient psych is differentiated from outpatient mental health services. Again, we wanted to that was something that we talked through with folks here. And those are kind of two ways categories fill out, but we didn't want to define it so specifically on our end. And so that's what those additional boxes are for further down, so that individual partnering providers can define those services and kind of spell them out a little bit differently. So I think this one came down to kind of how people use their language in their own organizations and wanting you to be able to define it that way. So essentially the comment boxes will help define that a little bit more. but we wanted to
Yeah.
give that flexibility.
It also gives us that room for kind of growth and change over time, you know, as new services are developed or become more prevalent here. This allows you to put it in, but then if you start to notice a trend where you really feel like something needs to be added to the capacity, it's still worth noting to me or to Better Health Together, because we can build on this over time. It's a completely custom build. So if, you know, we start to notice something that needs to be added, it's definitely possible.
And then,
yes, Sarah,
go ahead, Dan.
Sarah and Jessica, this is Dan Barth. I really appreciate seeing this, and at the same time, also compliment to Sarah and Ron for helping develop this. I'm excited to kind of get under the hood of this now with you, Jessica, to kind of fill out the remaining pieces of it. But this is really exciting to lay this out. My next question would be, when it comes to the med-surg system and like hospitals and their social work teams, how would they access this when they're like in the, you know, the psych triage? I'm thinking like at Sacred Heart is looking at something, then they have someone that's in the ED, you know, that needs substance use, you know, et cetera, or mental health services. How do they access it?
So from a technical standpoint, it is a public site with a URL. It'll be capacity-connect.com. And it is optimized to work on mobile, tablet, and desktop. So depending on what kind of technology they have, if they're using tablets, it'll still work great on there. As far as how that URL gets shared, from what I've heard so far, that's going to be kind of a, you know, communication effort from Better Health Together so that they know to go to it.
Great. So each, I'm just thinking, so they wouldn't have to create their own username and password there, that they can just access it, look at things, and then just go from there, correct?
Correct. The username and password is only for you guys to create a listing and edit it. So that would have to be requested. And also for admin to look at some, you know, tracking that we've added, you know, add those new accounts. There is a feature for admin to send you guys a reminder. So you may occasionally get a reminder from the website if you haven't updated it recently, things like that.
And Jessica, I can't remember if we put this feature in it for the final. Will the outward-facing website show how recently the listing was updated?
We did remove that. It would be an easy add if we feel like it's helpful, but we chose to just show the numbers and the corresponding colors.
Okay. So another question from the chat. Thanks for that question, Dan. That's a great one. Is if you are an open access clinic, what is the quantity that should be entered into the available openings? So in that capacity box. So if it's not necessarily a bed number, but it's just it's a walk-in type.
That might be something that needs to be decided internally. So is the case that walk-ins are always welcome and there is always room?
Yes, we do have some open access clinics in that way.
Okay. I mean, then I would definitely put a number there so it shows up as green, and maybe just keep a consistent number. And maybe that's 10 or 15, depending on what seems reasonable based on the other listings. We don't have a specific place to note that, but I would, in that case, make a note in the unique or special services area.
So you can think of it a little bit in terms of how many appointments could you see in a day in that way. And then can you, Jessica, talk a little bit about how things show up as red, yellow, and green? How is that calculated?
Yeah, so we may adjust this based on what we actually see in your guys' numbers. So it's still kind of an open decision. But basically, currently it's set up so that 0 is red, not applicable is gray, up to 10 is yellow, and then over 10 is green. But those are adjustable. That was just kind of a choice that we made as a developer until we see how this actually looks.
And is that defined on the front-facing page? Is there a spot that says green means 10 plus openings?
It's not currently, but I can definitely add that. That's a great note, and that would not be difficult at all. Just a little statement about kind of how it works and what they're seeing.
I think that would be useful. Curious from the group if that sounds like it'd be helpful to define.
So a little bit of feedback, if I may interject, because there was several of us that met yesterday to set this up. So there is a little bit of setup on the front end of this, has been reported. So you have to fill out these various little boxes specific to your agency. And so you'll have to, each individual agency, you'll have to decide, you know, how this best fits you. I know for us now, like we're co-occurring. All our RTFs and our outpatient is co-occurring. There's no box for that. And so I struggled a little bit. Do I want to say, let's see, the categories are addiction or mental health. So we decided to say mental health because of the way that we build the MCOs. So if someone comes in and they have a mental health diagnosis, what's the likelihood that they're going to also use substances? Pretty much guaranteed. But oftentimes people may come in with substance abuse diagnosis, but deny mental health. There we're not able to accept them. And so I didn't want to give the false impression that we're running a standalone SUD treatment, which we're not. So I'm just saying that each individual agency will have to tailor this to best describe what they do. We have some standalone facilities that don't necessarily interact with our other departments, and then some that are very interactive. So we decided just to put a central phone number, and we're going to let our front desk be the traffic controller and decide where the calls should go.
Thanks for that context, Ron. That's really helpful.
Yeah.
Well, it makes a lot of sense.
One note on that too.
Yeah.
Jessica and then Dan.
Okay. I was just going to say that if they do, in that case, function as pretty separate facilities, even if they have the same, you know, are in the same building, but it's a different suite number, a different phone number you want them to call, you could create multiple listings if you think that would benefit the people that are going to be searching. It's really an internal choice for you, but I just wanted to give you that option, Ron.
Thank you.
And Dan, did you have a question or comment?
Well, just that makes a lot of sense, Ron, about the clarification on the mental health side of things relevant to like how that gets actually coded to the MCOs. I'm just excited to kind of to work with Jessica here to add to what the framework that you guys have built upon to really make this sucker fly, quite frankly, because I can see our entire social work team within our hospital actually doing back handspring, like in excitement, being able to see this when they're time to do discharge planning. And then also just all the daily operation stuff between all the med-surg hospitals and knowing their needs when they're trying to find placement for folks in crisis. The other piece of it that I feel like we'll also kind of move forward on is like Hallie from Compassion Addiction had mentioned, a lot of the just the open access clinics, so that this is they're properly represented, because you're going to have, I mean, it's not going to take long for this thing to get traction within the community. And I think even more so than outside of just your mental health professionals in the community, I think this is going to go really fast. So before we really start to promote this, I want to make sure that we feel like everyone that's a part of it, that's listed, feels properly represented. Because it will. This thing's going to go fast. Again, I'm just excited and appreciate BHT recognizing the need that we had voiced, and I'm just excited to see it and build on this.
Thank you, Dan.
Sarah, it's Kelly at FBH. Kind of something that Ron said and kind of linking to what Dan said. I struggled a little bit too with knowing, like, do I list all 18 facilities? Well, probably not, because most of them do the same thing. Do I list our inpatient facilities separate than our outpatient? I think for the stakeholders, the people that are first going to do this, we should maybe be consistent with how we do that, because that will impact the end user's functionality of this, like Dan is saying. So if I am an outpatient social worker and I'm looking for current capacity for inpatient, do I have to know to look at 3 FBH things and an INBHS and this and that? I think if we're consistent in the way we put the data in, then we can be consistent in the way the data is pulled out. And Jessica, one of the things I was hoping you could show is kind of what a search result looks like. Do we have to go agency by agency? Because I know for us, definitely this is something we'll be using to start with our access to care, where people maybe are coming in and we're not the best service provider. But I'm with Dan, this is going to start being used to transition and coordinate care when people have been in services. So I think it's just important that we think about the end user experience.
Thank you, Kelly. That's really helpful. I'd be interested to hear from the group what you think the better approach there would be. This is intended to be that you can set it up like we mentioned, either as a facility or at an organization level. But as you can see here, the current capacity will show your that separately the inpatient psych versus the outpatient mental health services. So really it's a question of the contact information and what shows up. So if you have a central kind of front desk or someone who can make those connections to the correct services. But I think that there's also the, so that's kind of the question on the user end, is what would be more useful. So I guess two things that I'd like to hear from you guys on. One, what do you think from the facility end about just having one entry per organization to start? And does that make sense in terms of for contact information?
I can weigh in on my first. I think for me, I'm a little biased though, because I get to work with all our fine community partners every day. So I feel like for me, I could go to STARS and have some familiarity of all the different services. So that would argue just one per organization. I don't know that line staff are that familiar and versed, so they might want to get drilled down more into a detailed level. But I'm just cautious that if we, like FBH, for example, 18 locations is going to overwhelm the crap out of this system. So selfishly, I kind of want to do it at the organizational level just to make this a super useful tool to get rolling out. But I can be swayed either way, Sarah.
Yeah.
And for us, we decided that it was better to have that central person to call that is well trained, that can direct traffic. Because take withdrawal management, for example. That's one of the more popular, more needed services that we provide. But you have to go through sobering before you get into withdrawal management. Used to be, before we started doing it that way, everybody's calling and we're telling them, call back in 2 hours, call back in 2 hours. We don't want to do that. So if somebody's willing to come into sobering, spend a few hours, we're going to try to get you up to withdrawal management. That's a conversation that Monica at our front desk will have with you. There's not really a spot to detail all that on this desktop. Does that make sense? mean, that's a lot of information to just put, and people are going, what is sobering? And yeah.
Yeah.
Yeah, this is Sarah from Daybreak. I agree. I think the best is to have it per organization, because if we're also looking at the user, it might be overwhelming for them if they're not as familiar with the systems like we are. So what we're doing is we have one contact, it's our admissions. They can then guide them to outpatient, ENT, or any of our other programs once they have that conversation.
Yeah, that's kind of what I'm thinking of doing at Frontier, is just one and kind of 1 or 2 point people that can help. It gets a little messy with the inpatient stuff, but at least they could direct them to an inpatient coordinator, admissions coordinator. Just if anything, they're directing traffic so that we're
Exactly.
getting these people in the right place. Yep, I agree.
Yep.
So we have some agreement in the chat as well, and someone points out that they didn't know that FBH had that many locations and wouldn't, as a user, know how to navigate that to get to the right call-in place. So
I work here and I don't even know how to navigate that many locations.
So okay, so it sounds like the good approach here would be at least to start out, and we can, as Jessica mentioned, this is very adaptable. But let's plan to start out then with 1 entry per organization. And we'll see how that goes both for you. It will certainly simplify it for you as the provider putting information in on the back end. And then we'll see how that works for the users as well. How does that sound?
Yeah, that makes perfect sense to do that, because I look at this in the perspective of social workers and sort of like mid-level providers in whatever facility capacity they work within, and so that they can instantly. I mean, let's think about the original function for this is instantly being able to look at resources and then capacity and who do I get a hold of? Because that's the one thing that I hear consistently from social work teams, and not this is outside of our hospital too, is that they just need to know who to get a hold of to coordinate things. So if that funnel, so to speak, is just services, capacity, right, and point of contact. I mean, what's the rule of thumb? I mean, you don't want to have more than someone have to navigate more than 3 buttons. I think the folks at Zipline probably have better data than I do on that. But again, keeping it simple, at least in the first phases, makes sense.
Great. And maybe on Better Health Together's end, we can put, in addition to sharing out Jessica's information to get you guys started, just a quick, based on this conversation, the kind of bullet points of things to know, things to do, to say we're doing this at the organization level. Here's how you can, you can customize these pieces, kind of imagine a central point of contact. So we can do that pretty easily. And actually, as I'm thinking about that kind of as a design guide, looking under insurance accepted, and Jessica, correct me if I'm wrong, but that's just an open field for folks to put in.
It is.
And it is, okay. And just thinking about for the end user, MCO is probably more of an internal term, and if anybody, so maybe it's a little bit more using language like Apple Health, because this will be open not only for our care coordinators and navigators to use, but also community facing, because it is on the front end. So just thinking a little bit about the language that we use there as well, that I don't think most of our community members know what an MCO is as much as we are steeped in that language. So, and great. So a few other things in the chat. One, just to go back to the earlier question around how do you search here. So you can see all the filterable services on the side. You can also search by zip code. but we just got a question in the chat to if the insurance accepted was a searchable feature. And I think we'd have to probably set up that field a little bit differently to be something that's more check boxes that, you know, says that you accept Medicaid / Apple Health, Medicare, private insurance, versus being able to define that more clearly. Is that correct, Jessica?
That is, yeah. And the reason we didn't do that is that we wanted to make sure we weren't limiting you guys, because there are a number of different insurances. There might be some special notes that you have. It is definitely an option though. So if we decide we want to switch over to a drop-down checkbox, something like that, we definitely could. And then we would be able to add a search or filter by insurances accepted.
Thoughts from the group on that one? We do have some adaptability here, but I'd like to hear from you guys if that would be helpful, or if we're assuming at this point that who we are putting in is Medicaid providers. So.
Oh, hi, Sarah. This is Gail Kogel with the Ombuds Office, and I probably was going to have just a comment that doesn't relate here then, because we often get calls from people who don't know where to go, and sometimes they have Medicare, and not that many people take Medicaid and Medicare, and that's a real barrier for folks. I don't know if that would ever be, if it ever does become a searchable field for the types of insurance, that might be useful.
Okay, thank you. And some comments in the chat that a search filter by insurance is necessary, including a private comment about that I know many of you don't necessarily contract with all of the MCOs, so it might also be helpful to say which Medicaid or Apple Care, but that's also that also gets a little bit into then you having publicly viewable whether or not you contract with each of the MCOs. So I'd like to hear, if we do add a search filter, from your perspective, we would want to have Medicaid, Medicare, private insurance. Do we want to get to the level of which Medicaid, or which Apple Health plans?
I'd like to encourage us maybe to not get to that level of detail until we start using it. Because if I think about insurances, like, you know, we take hundreds of different types of insurances. I hate to keep that updated, but contracts and negotiations change all the time. Rather, I would like the point person or the expert at the agency to navigate that. I know at FBH, while we contract with all the MCOs, we have additional funding outside of the MCOs that sometimes we can apply. And I would not want to put all that criteria on a website. I would rather want the specialist at our agency to walk through that. I feel like that level of detail will restrain us just to get started. Maybe we can revisit it.
Okay. Kelly, as a follow-up to that, do you think the level of detail of just Medicaid, Medicare, private insurance, and maybe additional options or something like that would be appropriate, or to start the way we have?
I think so, because like Gail's saying, you know, there's just very few resources for Medicare only. Sometimes, like I know our capacity changes based on the number of providers we have. And so that's the purpose of this, right? Is any given day, we might have a few Medicare openings. We'd want to update that so people know in the community. So I think the broad, and Joy just commented, the broad categories might make sense, but I think if we get too detailed, we're going to tie ourselves in knots. Okay.
I absolutely agree. I mean, you just go Medicaid, Medicare, private, and then maybe something like TRICARE, TriWest for like the veteran community, something like that.
And maybe sliding fee too.
Yeah, and sliding too, or no insurance.
Yeah,
because people can sign up for Medicaid.
Okay, great. I am taking furious sticky notes. So I think that that is definitely an adaptation that we can make before launching. And maybe we can leave an open comment box like we do on some of these others that folks can put a level of detail they're interested in including. But as far as the searchable features, keep it a little bit broad categories. Okay, excellent. Thank you guys. I mean, that's why we bring this to you and talk to you about it. So I think I have, let me make sure I'm not missing any. Oh, we have a question in the chat. I'm glad I scrolled back up. Around if it would be helpful to have a category for whys. Erin, are you thinking in kind of the current capacity and what those bubbles are to add whys?
Yes, filter by services is sort of what I was thinking of. Just because I've heard from our child welfare program coordinator that it's been really difficult for families to navigate who has openings in wraparound.
Okay, great. I think that's when we went back and forth on in the design phase, and Jessica, is that fairly easy to add in?
It is, yeah. And just a note on that, the way we set it up is so that the filter by services list is always going to match the current capacity list over on the right. So it will appear in both places if that works for everybody.
And to that end is, and maybe folks who were part of the process of designing can talk about, is there a reason we did not include MAT on this list versus having it out elsewhere?
That was definitely a decision from possibly Charisse, but someone at BHT. That would have been something we would have gone to you guys on. And Charisse was actually the one that sent me like the final capacity categories. But again, they are, we can update them, so.
Okay. And that may have been something where it was a level of detail that the users may not necessarily know, and it's a treatment decision once they get in. So that might be some of that. So, okay. Great. Do we have any other questions, concerns, comments, compliments, anything in our last few minutes here? Well done. All right.
So just to clarify, Sarah, are you going to send out my contact info so I can set up the user account?
Yes, I will. We'll get that sent out hopefully later today or tomorrow. We'll also upload this recording and share out with everyone, as well as just the note that we are going to do it at the organization level rather than entering at the facility or site level. And then, Jessica, I will follow up with you about making those few changes around adding whys and adding the insurance options. But it sounds like we can at least start getting people set up in the system before we've added those options, and then that'll just pop up as an additional thing for them to fill in the future. Is that correct?
Yeah, we would probably just want to send out a reminder once we add something so that they, can just be reminded to go in and check that box, or maybe it doesn't apply and they can ignore it.
Great. Great. Well, thank you so much. We are so excited to get this launched. And thank you again to Jessica and your team at Zipline, to Ron and Sarah and Kelly and all our focus group folks who helped develop this. And I think this is going to be a really great resource for our community. So thanks so much.
Thanks, Sarah and Jessica.
Thanks.